Alright, so this is Chapter 2 of the ATI Nutrition Ingestion, Digestion, Absorption, and Metabolism. Ingestion is the process of consuming food by the mouth and moving it through the digestive system. Digestion is a systemic process that includes the breakdown and absorption of nutrients. Absorption occurs as components of nutrients pass through the digestive system into the bloodstream and lymphatic system. Metabolism is the sum of all chemical processes that occur on a cellular level to maintain homeostasis. Metabolism is comprised of catabolism, the breaking down of substances with the resultant release of energy, and anabolism, the use of energy to build or repair substances. Energy nutrients are metabolized to provide carbon dioxide, water, and adenosine triphosphate, which is ATP. Excess energy nutrients are stored, glucose is converted to glycogen and stored in the liver and muscle tissue. Surplus glucose is converted to fat, glycerol and fatty acids are reassembled into triglycerides and stored in adipose tissue, and amino acids make body proteins. The liver removes nitrogen from amino acids, and the remaining product is converted to glucose or fat for energy. Body cells use first available ATP for growth and repair, then use glycogen and stored fat. The metabolic rate. Metabolic rate refers to the speed at which food energy is burned. Basal metabolic rate, or BMR, also called basal energy expenditure, or BEE, refers to the amount of energy used in 24 hours for involuntary activities of the body, maintaining body temperature, heartbeat, circulation, and respirations. This rate is determined while at rest and following a 12-hour fast. Resting metabolic rate, or RMR, also called resting energy expenditure, or REE, refers to the calories needed for involuntary activities of the body at rest. This rate does not consider the 12-hour fast criteria. BMR is affected by lean body mass and hormones. Body surface area, age, and sex are also factors that contribute to BMR. In general, individuals who are assigned male sex at birth have a higher metabolic rate than individuals who were assigned female sex at birth due to their higher amount of body muscle and decreased amount of fat. Thyroid function tests can be used as an indirect measure of BMR. Acute stress causes an increase in metabolism, blood glucose levels, and protein catabolism. A major nutritional concern during acute stress is protein deficiency, as stress hormones break down protein at very rapid rate. Protein deficiency increases the risk of complications from severe trauma or critical illness, skin breakdown, delayed wound healing, infections, organ failure, ulcers, impaired medication intolerance. Protein requirement can be increased to more than 2 grams per kilogram of body weight, or up to 25% of total calories, depending on the client's age and prior nutritional status. Any catabolic illness, such as surgery or extensive burns, increases the body's requirement for calories to meet the demands of an increased BMR. Disease and sepsis also increase metabolic demands and can lead to starvation and death. Factors affecting metabolic rate. Increased BMR. This is lean muscle body build. Exposure to extreme temperatures, prolonged stress, rapid growth periods, infancy or puberty, pregnancy and lactation, and physical conditioning. Decreased BMR is short, overweight body build, starvation and malnutrition, age-related loss of lean body masses. Conditions. Increased metabolism, fever, involuntary muscle tremors, shivering, Parkinson's, hyperthyroidism, cancer, cardiac failure, burns, surgery, wound healing, HIV and AIDS. Decreased metabolism is hypothyroidism. Medications increase BMR, epinephrine, levothyroxine, and ephedrine sulfate. Decreased BMR is opioids, muscle relaxants, and barbiturates. Nitrogen balance. Nitrogen balance refers to the difference between the daily intake and excretion of nitrogen. It is also an indicator of tissue integrity. A healthy adult experiencing a stable weight is in nitrogen equilibrium, also known as neutral nitrogen balance. Positive nitrogen balance indicates that the intake of nitrogen exceeds excretion. Specifically, the body builds more tissue than it breaks down. This normally occurs during periods of growth, infancy, childhood, adolescence, pregnancy, and lactation. Negative nitrogen balance indicates that the excretion of nitrogen exceeds intake. The individual is receiving insufficient protein and the body is breaking down more tissue than it is building, as seen during periods of illness, trauma, aging, and malnutrition. Assessment and data collection. Weight and history of recent weight patterns, medical history for disease that affects metabolism and nitrogen balance, extent of traumatic injuries as appropriate, fluid and electrolyte status, laboratory values, albumin, transferrin, glucose, and creatinine, clinical findings of malnutrition, pitting edema, hair loss, wasted appearance, medication adverse effects that can affect nutrition, usual 24-hour dietary intake, use of nutritional supplements, herbal supplements, vitamins and minerals, and use of alcohol, caffeine, and nicotine. Nursing interventions. Monitor food intake. Monitor fluid intake and output. Use client-centered approach to address disease-specific problems with ingestion, digestion, or medication regime. Collaborate with dietitian. Provide adequate calories and high-quality protein. Strategies to increase protein caloric content. Add skim milk powder to milk, double-strength milk. Use whole milk instead of water in recipes. Add cheese, peanut butter, chopped hard-boiled eggs, or yogurt to foods. Dip meats in eggs or milk and coat with breadcrumbs before cooking. Nuts and dried beans are significant sources of protein. These are good alternatives for dairy, allergy, or lactose intolerant. Okay, so a nurse is discussing how the body uses nutrients for energy with the client during a primary care visit. Match each substance with the statement that describes how the body stores or processes it for energy. So, glucose is converted to glycogen and stored in liver and muscle tissue. ATP is used before glycogen and stored fat for growth and repair. Amino acids is used to synthesize proteins, and fatty acids are converted to triglycerides and stored in adipose tissue. A charge nurse is conducting a nutritional class for a group of newly licensed nurses regarding basal metabolic rate, or BMR. Sort each fact. I don't care about that. A nurse is reviewing prescribed medications for newly admitted clients. Which do the nurse recognize as type of medications that decrease the BMR? Barbiturates and opioids. A nurse is caring for a client with negative nitrogen balance. Which of the following does the nurse recognize as possible causes of negative nitrogen balance? Critical illness, starvation, and trauma.